Welcome to The Remedy with Dr. Rani Whitfield, where medicine, music, literacy, and other hot topics meet. I'm Dr. Rani, aka the Hip Hop Doc, and today we're literally diving into cold therapy, ice baths, cold plunges, and cryo chambers. You've seen the trend with athletes, celebrities, and wellness influencers swearing by it. But is it hype or health? Can shivering in freezing water really reduce inflammation, boost your mood, or even improve longevity? Stick around, we're breaking the ice on the history, science, benefits, and risk of cold therapy. What if shocking the body is the key to calming your mind? Cold therapy might seem like a new trend, but its roots run deep. In Finland, people jump from hot saunas into icy lakes. In Japan, the massaging ritual uses cold water for purification. The ancient Greeks and Romans used cold baths for healing, believing in water's restorative powers. Fast forward to today, and you've got people like Wim Hof, the Iceman, showcasing cold exposure on social media. Athletes swear by ice baths for recovery, and cryotherapy studios are popping up in major cities. This ancient practice has officially gone mainstream. But can a cold plunge a day keep inflammation at bay? Let's find out. Cold exposure has been used for centuries. The Greeks and Romans believed it could heal muscles and balance the body. In the 19th century, hydrotherapy, using water to treat pain and stress, was all the rage. Today's revival started with Wim Hof, who paired cold immersion with breathing techniques to improve endurance and immunity. Athletes began using ice baths post-game, and now even backyard cold plunge setups are trending. For those of you watching my YouTube channel, here I am testing out my very own cold plunge. Not having a chiller and buying ice on the days I decide to freeze myself was not only expensive, but very time consuming. My suggestion is, if you go down this path and can't afford it, buy an ice bath or tub with its own chiller. It will save you time and money. So what actually happens when you go cold? When you immerse yourself in cold water, your body activates survival mechanisms. Vasoconstriction is one. Blood vessels in your extremities tighten, conserving heat in your core. This reduces inflammation and swelling. Shivering, your muscles contract rapidly, increasing heat production by up to 400%. Brown fat activation. Brown fat in the body burns calories to generate heat. Think of it as your body's internal furnace. It heats you up while burning energy. Cold exposure triggers the release of the hormone norepinephrine, which reduces stress, sharpens focus, and lifts mood. I was once told, shiver smarter, not harder, because succinate, a metabolite that plays a role in energy production, is released during shivering, a potential secret weapon for burning fat and staying warm. So what are the benefits of cold therapy? Recovery after exercise is one. Cold water immersion reduces delayed onset muscle soreness. Studies show that 10 to 15 minutes in water between 50 and 59 degrees Fahrenheit improves muscle recovery and reduces pain. But timing matters. If you are strength training, avoid cold exposure immediately after your session. It can blunt muscle growth by reducing inflammation. So wait 3 to 6 hours to balance recovery and gains. Mood enhancement. Cold therapy boosts norepinephrine and dopamine levels, which can possibly improve mental clarity and reduce depression. Some call it a runner's high for the brain. Weight loss and brown fat activation. Cold exposure activates brown fat, which burns calories to generate heat. But here's the catch. Adults don't have enough brown fat for significant weight loss. Longevity. While some animal studies suggest cold exposure might extend lifespan, no solid evidence exists for humans. Cold therapy can enhance recovery and resilience, but it's not a fountain of youth. There are some risks associated with cold therapy. Cold shock. Sudden immersion can cause hyperventilation and a spike in heart rate. People with heart conditions or hypertension should proceed with caution when they start their cold plunge therapy. Hypothermia. Prolonged exposure to very cold water can lower your body temperature very dangerously, so be careful. Overuse. Too much cold exposure can blunt long-term muscle growth and even irritate the skin. So remember, cold is bold, but don't overdo the hold. So here are my practical tips for beginners. Start small. Begin with a 30-second cold water shower. At the end of your shower, you can probably do it, gradually increase the duration in the shower for 1 to 2 minutes, and then graduate to the cold plunge. If you can afford a chiller, this will allow you to control the temperature. I started my temperature a little bit higher, 60 degrees, and worked my way down. So you can start at a higher temperature and slowly decrease the temperature over several weeks by a few degrees until you reach the desired level of coldness. Be consistent. Once you build up the courage to take the plunge, aim for 2 to 3 sessions per week. You can actually do it every day, but you don't need to do it over 11 minutes of cold exposure a week. Per most researchers, 11 minutes of cold exposure a week is the minimum amount needed to reap the potential health benefits, like reducing inflammation, improving mood, and enhancing circulation. Embrace the shiver. Shivering is a sign your body is adapting. It's not weakness, it's progress. And always stay safe. If you feel dizzy or lightheaded, stop immediately. Those with medical conditions should always consult a doctor first before starting this journey. Remember, it's not about how long you stay, it's about showing up every day. Cold therapy isn't just a trend, it can be a tool. From reducing inflammation to boosting mood and mental resilience, it offers real benefits when done safely and consistently. But remember, it's not a one-size-fits-all solution. Listen to your body, ease into it, use it as a part of a balanced wellness routine, and always consult a physician before you start a program like this. Thanks for tuning in to The Remedy with Dr. Rani Whitfield. Remember, we're born looking like our parents, but we die looking like our decisions. Choose health today. If you enjoyed this episode, subscribe to my YouTube channel or follow me on Spotify, Apple Podcasts, or wherever you get your audio fix. For more tips and updates, tune in weekly for a new episode. Stay cool, stay healthy, and I'll catch you next time. It's the Hip Hop Doc. They call me H2D. Come on, y'all. Let's get hip hop healthy. Peace and blessings. I'm out.
The content on The Remedy with Dr. Rani Whitfield is for informational purposes only and is not intended as medical advice. Always consult with your healthcare provider for personalized medical guidance. Dr. Rani Whitfield is a licensed family physician, but the information provided on this podcast should not replace professional medical consultation.